Good morning, Dr. Guantwa.
Good
How
morning,
are you?
Fatma. I'm happy to see you. You
I'm
have a
happy to
big
see you too.
smile on your face. What's up?
Of course, I have excellent news.
Really?
I'm pregnant.
Oh, wow.
Yes, this is going to be my second child, as you know. We've been through this, but of course, I want to come back and learn a few things from you again on how to keep myself and the baby healthy.
I'm very happy to hear this wonderful news, Fatma. Congratulations.
Thank you.
And I hope you have a healthy pregnancy and the successful birth of an active, healthy baby.
Thank you.
You know, Fatma, the best way for you to have a healthy baby is to make sure your body is as healthy as it can be.
Okay.
Your unborn baby is depending entirely on your body to supply it with the nutrients and other essential building blocks it needs to develop and grow while it is inside of you. The unborn baby inside of you receives everything it uses for development through your body, both good and bad. So if you're eating foods that are rich in nutrients such as meats, vegetables, fruits, and nuts, and you're taking supplements that are important during pregnancy, this is good for your unborn baby. On the other hand, if you have poor nutrition, you drink alcohol such as beer or spirits, you smoke, or you take drugs, this can harm your unborn child.
I see.
The good news here is that you have much of the control of what happens with your unborn baby child by what you do or you don't do. It is your choice and your responsibility.
Well, I understand the importance of taking care of myself now, Dr. Guantwa, but what can I do?
There are many things you can do to help your unborn baby and important things to stay away from so you don't harm your baby. In fact, learning about these things is a major reason you come to see your doctor or nurse during your pregnancy.
Okay.
These visits to a doctor or nurse during pregnancy are called antenatal care visits, or ANC.
Oh.
And the word antenatal means before birth. So let's talk about a few other helpful medical words.
Okay.
Prior to when a baby is born, an unborn baby is also commonly called a fetus.
Okay.
A fetus is the same thing as unborn baby. And then the fetus is called a baby after birth.
Oh, I understand. I've heard of these terms, but it is good to know what they mean, what they actually mean.
Good. A pregnant woman should have 4 antenatal care visits during a normal pregnancy. More visits may be needed if problems arise with the pregnancy. During these visits, the skilled birth attendant, such as a nurse or doctor, will talk with the mother. They'll answer questions and teach the mother about nutrition, supplements, and things to avoid to protect your fetus. The mother will also be examined to evaluate her health and see how the fetus is growing and positioned. The skilled birth attendant will watch for illnesses such as malaria, TB, or low blood iron, a condition also called anemia. Supplements such as iron and folate will be given to the mother to prevent or treat anemia. The skilled birth attendant will also test you and your partner for HIV or other sexually transmitted infections during your first antenatal care visit, and they will start treatment if any illnesses are present. Testing for HIV is very important because treatment can be given to the mother to make her healthier and prevent the baby from becoming infected with HIV.
It sounds like a lot happens during these 4 antenatal care visits with my skilled birth attendant. But what is a skilled birth attendant?
Good question, Fatma. Okay. A skilled birth attendant is a nurse, a doctor, or other healthcare provider that has been trained to provide care to pregnant women, help with delivery, and care for the mother and the baby after delivery.
Okay. And, can I bring my husband maybe to one of these visits?
Yes, it would be best if you would bring your husband, your partner, or even a friend to these antenatal care visits with you. That way, other important people in your life will know how to help you have a healthy pregnancy and baby. They can also help you remember what you learned during the antenatal care visits. And also the father of the baby should be tested for HIV when you are tested.
Okay, then I think I will bring my husband next time to one of these visits. He will be very interested to hear what you have to say. And I don't want to miss anything that might help me or my unborn child.
That's good.
You mentioned earlier that one purpose of the ANC visits is to look for the potential problems. What kind of problems do you mean, doctor?
There are many changes in your body with pregnancy, and
Okay.
the fetus is a completely new life. So we need to watch you both closely.
Okay.
Many potential problems can be avoided if proper care is taken. If we see problems developing, they can often be treated or eliminated by dealing with them before they become serious. Some examples of problem would be high blood pressure, parasites, malaria, or anemia.
This is a lot to think about for now.
Yes,
I'm listening.
you will learn.
Okay.
That is why you are here, right?
Yes.
So let's start by going through all the things you should know and do to have a healthy baby. We'll talk about one thing at a time, and I will make sure you understand it as we go along.
Okay.
Perhaps we should have several visits for these conversations. Does that sound good to you?
That sounds very good, doctor. Very good.
That's good, because I think so too. Well, this visit, let's talk about things you can do to have a healthy pregnancy.
Okay.
Then with the next visit, we'll talk about ways to protect you from infectious disease. And later, we'll talk about how to start your new baby on a healthy life after it is born.
Okay.
How to reduce stunting and anemia as it grows, and how to protect it from illness, particularly infectious diseases such as malaria and parasites. This will be a total of 5 talks, but they will be short, and that will give you time to think about each topic and questions the next time.
Okay.
Are you ready to begin?
Of course, doctor.
Great! First, let me tell you something that I think is very important in health.
Okay.
Prevention is better than cure. I am a doctor and I cure people for a living, but it is far better to prevent a person from becoming ill in the first place than to have us see a doctor and need treatment for an illness. By preventing an illness, it also prevents the suffering and danger of being sick. It is just better not to get sick in the first place.
Yeah, that's true. I see what you mean, Dr. Guantua. No one wants to get sick.
I know this seems obvious, but it is something many people do not think about. I suppose some people do not know about ways to prevent illness, or perhaps they think they will never get ill.
Well, no one expects to get sick, but it happens all the time. Maybe it's just supposed to happen sometimes.
No, Fatma, this is a common error of thinking. Sometimes illness happens that is beyond our control, but as a doctor, I can tell you that nearly all illnesses are actually preventable. That is why I'm making this important point to you right now. You have much of the control of what happens to you and your baby before and after birth.
Well, prevention is better than cure. I will remember that and practice as much as I can. Since you taught me this, I will keep it in my mind, Dr. Guantua.
Thank you so much for listening to me seriously, Fatma.
Thank you.
I want people to know this good information, and it can be frustrating when they don't make an effort.
Okay.
Healthcare depends on the teamwork of the skilled birth attendants and the mother.
Okay.
There are many ways to prevent illnesses. I'm going to tell you about something that is simple to do, but it is very effective at preventing disease. It is the simple act of washing your hands with soap and safe water.
Really?
Yes.
Soap and water?
This is one of the most important things you
Safe
can do.
water.
It is simple, but it works.
Okay, I'm listening. And again, why is it important?
Let me explain some background to you first.
Okay.
Microbes are small living organisms. There are 3 general types of microbes: bacteria, viruses, and parasites. Bacteria, viruses, and parasites are all around us, and many of them do not bother us at all. However, certain bacteria, viruses, and parasites cause almost all the infections that people suffer. For example, cholera, blood infection, food poisoning, some pneumonias, and some types of diarrhea are all caused by different types of bacteria. Viruses cause other infections such as measles, the common cold, and HIV or AIDS. Common parasites are malaria, intestinal worms, and schistosomiasis. Overall, microbes can cause many of the illnesses we experience.
Okay.
Microbes need to move from an infected person to a non-infected person to spread infectious disease.
Okay.
Some microbes spread through small water droplets in the sneeze or cough of an infected person.
Okay.
Some examples are like pneumonia, TB, or the common cold.
Okay.
An infected person who sneezes or coughs on someone else can spread an infection this way. Also, if I were to sneeze on my hands and then shake your hands,
Okay.
then you were to rub your nose or eye with that hand, you could get my illness.
I see.
Do you see how this can happen?
Yeah. It's scary, but yeah.
Yeah, generally the skin is a good barrier to infection, but the eyes, nose, and mouth are common places for microbes to get into the body,
Okay.
just as I described.
Okay.
But another way is infected feces. Microbes spread from one person to another through the infected feces. If a person has diarrhea from diarrhea from parasites or bacteria, the eggs of the parasites or the bacteria that causes the diarrhea are in that person's feces.
Okay.
If the parasite's eggs get on our hands, in our food, or on our eating utensils in any way, they can make their way to our mouth and infect us when we swallow them. So our hands are often the way they get in our mouths.
How is that?
Well, think of all the things that you touch every day.
Okay.
You shake people's hands, you touch doorknobs,
Yes.
you use a latrine, you touch railings. These same things may have been touched by other people who did not wash their hands after using the bathroom, or who coughed or sneezed into their hands.
Okay.
And microbes on the things you touched may get on your hands now.
Okay.
And then they may enter your mouth when you eat, or enter your eyes or nose when you rub them. And these are the common ways that people get infections from other people.
Okay.
And another one that I want to tell you about is the soil. Soil is also a common way for parasite eggs to be transmitted.
Okay.
So eggs from feces gets into the soil when someone doesn't use the latrine.
Okay.
And then eggs can get on our hands or on the fruits or vegetables we eat, and then get into our mouths where they infect our body.
Okay.
Now, if we wash our hands using running, safe water and rubbing them with soap, that will kill or remove them, all the microbes, and greatly reduce the chance of us being infected. We cannot stop touching everything around us that may have bad microbes on it, but we can wash our hands so the microbes don't get into our mouth, eyes, or nose.
But what if we don't have any soap?
That's a good question, Fatma. Soap is the best at killing and removing microbes from our hands.
Okay.
But ashes, salt, lemon juice, or lime juice can work as well if soap is not available. When you wash your hands, use running, safe water. Washing them should take about the same time it takes to sing the national anthem. That is an easy way to remember how long to wash.
Dr. Guanto, you're very funny. But I've come to an understanding you say safe water, not just water. What is
That's
safe
correct.
water?
We have been talking about how hands can get microbes on them and make us sick.
Yes.
But there are other ways bacteria, viruses, and parasites can get into our bodies. One way is if the water we drink contains harmful microbes.
Okay.
For example, if you use river water for drinking, there may be a latrine upstream that leaks into the river, or someone may have defecated near the river. Then the rain might come and wash some of the feces into the river, bringing the microbes with it.
Okay.
Some of those microbes can then be in the water you collect from the river, and this water is what we call unsafe.
Okay.
If you use that unsafe water to cook with, the microbes can get in your food. If you wash your baby with that water, microbes can get in your baby's eyes, nose, or mouth and make it sick. If you or your family drinks unsafe water, you could all get diseases such as parasites, diarrhea, hepatitis, and other illnesses. Now, safe water is water that has been collected from a safe source, such as government-tested borehole or commercial bottled water, or has been treated to make it safe.
Treated. How can I treat unsafe water to make it safe?
There are 4 good ways to treat water to make it safe.
Okay.
One way is to boil it for 1 minute, and this should be a rolling boil. Another way is to use water chemical treatment, such as pure or aqua tubs. These use a chemical called chlorine to make the water safe. The chlorine has a particular smell for a while after treatment, but it is completely safe for us to drink. A third way is to use a special water filter that removes microbes. The special filter works quickly, it lasts for many years, and the treated water doesn't smell or taste odd. And the last way is to use solar disinfection. We also call this SODIS. To make water safe using this SODIS way, you remove the label from an empty commercial water bottle, fill it with unsafe water that has been poured through 4 layers of kanga cloth to get some of the particles out of it. Then fill the container and close it up. If you put these containers in the direct sun for 4 hours, it will be safe to drink. If the sky is cloudy, it will be safe after it has been outside for 2 days. Solar disinfection is simple and inexpensive to do.
Well, the water will be safe just from being under the sun or in the daylight?
Yes, some of the light rays from the sun kill microbes, even on cloudy days.
That's interesting.
Yeah, it is. And so everyone in your family should wash their hands often with running safe water using soap, ash, salt, lemon, or lime juice.
Dr. Guantua, what do you mean by running water? Can't I just use a regular basin or a bowl to wash my hands in?
That is a good question, Fatma. If you use a bowl or a basin to wash in, the water will be unsafe as soon as you put your hands in, because microbes are on your hands. Therefore, it is best to use water that is poured or comes out of a faucet like a bucket with a spigot or a tippy-tappy. That way, the water passing over your hands is always safe water. When do you think would be good times to wash your hands, Fatma?
Well, we should wash hands before cooking, before eating, and of course before touching the things that we will eat, like plates, glasses, and cooking pans as well need to be washed, right?
Very good. How about with childcare?
Well, okay, we should wash our hands before breastfeeding, before feeding the children, and certainly after changing the baby's diaper. We should even wash our children's hands since they are always putting them in their mouths, right?
Exactly.
Okay.
How about when we go to the bathroom?
Okay. We should always wash our hands after using the toilet or latrine. I presume that is particularly important. And after coughing, sneezing, or blowing our noses, right?
Yes. And we should wash before and after taking care of sick people to avoid spreading their illness or giving them another illness.
Okay.
We should wash hands after preparing raw meat or poultry, since some parasites are in raw or undercooked meat. This is why it is important to thoroughly cook meat.
Okay.
You must also wash fruits and vegetables with safe water before peeling or eating them to remove parasite eggs that have gotten on them. So use safe water for washing, drinking, and cooking. Also, wash your hands with safe water and soap often to protect yourself, your fetus, and your family.
Okay. I've heard about safe water and hand washing before, but now I understand how they can prevent diseases from spreading from a sick person to a healthy person.
That's good, Fatma. Now, let's talk about some other things you can do to have a healthy baby.
Okay.
One condition many women suffer from is anemia. This is especially true for pregnant women.
Anemia. What is anemia?
Anemia is a medical condition where the body does not have enough healthy red blood cells or iron in the blood.
Okay.
Women are much more likely to have anemia than men because they lose some blood every month during their menses or period. Pregnant women are particularly likely to become anemic because more blood is needed to fuel the body for pregnancy and breastfeeding.
Okay.
Anemia is very common. In fact, over half of all pregnant women in Africa have anemia.
Really?
A woman with anemia may feel weak or tired, but she may also feel no symptoms at all. However, anemia is a serious threat because healthy red blood cells are needed for the proper development and growth of the fetus, as well as for the health of the pregnant mother.
Okay.
For example, pregnant women with severe anemia are often 3 times more likely to die during pregnancy or during delivery than pregnant women without anemia.
Wow.
So it is very important to prevent anemia during pregnancy. Here are some things that you can do, Fatma.
Okay.
First, you can increase the amount of healthy food you eat while you're pregnant.
Okay.
This will help prevent anemia, and your fetus needs the extra nutrients as well.
Okay.
So eat 1 additional meal and 1 nutritious snack every day.
Okay.
And also eat locally available foods that are rich in iron, such as red meats.
Okay.
Other meats such as fish and chicken also have iron, and so do dark green leafy vegetables, beans, and nuts. Many different fruits and vegetables also help your body absorb iron. Some foods are fortified with iron, and eating them can help as well.
Aren't these the foods that everyone should eat instead of sugar, starches, and processed foods?
That's correct. You are very correct that meats, beans, nuts, fruits, and vegetables are the types of nutritious foods everyone should eat.
Okay.
You just need more of the meats, dark green leafy vegetables,
Okay.
beans, and nuts because the extra iron in this is good for you during pregnancy.
Okay.
And another thing to do to prevent anemia is to take supplements. Anemia is so common during pregnancy, and that's why we give every pregnant woman supplement pills of iron and folate to help prevent it. Iron and folate should be taken daily throughout pregnancy to treat or prevent anemia.
Okay. I do take the pills and I like those foods as well. So I will eat plenty of meats, dark leafy vegetables, greens, I think such as spinach and kale, beans and nuts. And yeah, I think that's about it. I will make sure I do take the supplements you gave me, doctor. But what else can I do?
Good question. Previously, I said you should not drink alcohol, smoke,
Yes.
or use illegal drugs.
Yes. Correct.
All these can damage a fetus and cause permanent problems in your child.
Oh my goodness. Okay.
And I want to tell you also about iodine. This is a chemical in a diet that is needed by both you and your baby.
Okay.
But not much is needed, so food manufacturers add it to salt that is sold in most stores.
Okay.
This is a good way to get the iodine you need. But make sure the salt you buy says on the label that it contains iodine. There are also some things you can do to prevent yourself from getting an infectious disease. But we will talk about those during your next visits.
Okay.
There are several things you can do with your husband or partner to prepare your household for the new family member. Make sure you have wash stations in your home, blankets, diapers, and other supplies for the baby.
Okay.
Make sure you have saved enough money for the costs involved and have planned for transportation to the healthcare facility at a moment's notice. You know how delivery of a baby can surprise us sometimes.
I know, doctor. Trust me, I know. For the first child, it was a panic. But that was 3 years ago. I think I'm prepared now.
3 years ago?
Yes.
That is good spacing, Fatma.
Thank you, doctor. Thank you. But what do you mean by
Good spacing?
good spacing?
Yes.
I was looking for that word. I was carried away. Yes.
So if babies are born too close together, at less than 2 years, the risk to the mother and the baby goes up because the mother will not be fully recovered from her previous pregnancy and delivery.
Okay.
This is called spacing of pregnancy. For the safety of the baby and mother, we want the babies to be born at least 2 years apart. Also, it is best not to wait beyond 4.5 years from one baby to the next. Pregnancy can be a difficult process to endure, and we could recommend that women only get pregnant when their bodies are most ready for it.
Okay.
Therefore, it is best not to become pregnant when you are younger than 18 or older than 35 years old.
I can control when I have a baby by using contraceptives. These birth control methods can prevent pregnancy.
You're right, Fatma.
Okay.
There are many excellent methods of contraception available.
Okay.
The use of these birth control methods allows a woman and a partner to decide when it is the best time for another child.
Okay.
Potential parents need to think about the cost, effort, living situation, and even their other children in making this decision. Adding another family member has many consequences. I can talk with you about contraception options later.
Okay. You talked about risks. What should I watch for or watch out for a while I'm pregnant?
Let me tell you about some warning signs to watch for during pregnancy.
Okay.
If you have any of these warning signs, you should immediately go to the hospital or health center. If you're feeling breathless, tired, or having a fast heartbeat, you know when you say my heart is racing?
Yes.
That may indicate anemia. Any bleeding from the vagina, a foul smelling, any draining or liquid, that's a sign that you should run and see to the health center or go see your doctor.
Okay.
Bad headaches, blurred vision, excessive swelling of feet, hands, and face, or severe nausea and vomiting. Also, if you have fever, shivering, chills, and sweats, those are all indication that you need to you need to go to the healthcare facility and be seen. If you feel that your baby has stopped moving or the baby is moving less than normal, or you feel an abdominal pain, or you get a seizure or fits, all these are warning signs and you must be seen by a healthcare attendant immediately.
Oh, thank you, doctor. I will watch for these warning signs and seek health care immediately. If any of these appear, trust me, I will run to the doctor.
Well, now you see how much you can learn at your antenatal care visits.
Yes, true.
I will tell you about ways to protect yourself from infectious disease at your next one.
Oh, thank you. It was so nice taking this seat with you, and I will see you soon, Dr. Guanto.
I will see you too, Fatma.
Thank you.
Take a
Okay.
good care of yourself now.
Okay.